Joe, tell me a little about yourself.
I'm the president of Inspira Health Group. I'm a registered nurse. I'm a licensed nursing home administrator. I've been fortunate enough to basically work for the same company since I got out of nursing school in 1996.
How did you first choose to go into nursing and to study nursing that put you on this track?
So I was in the Marine Corps. I got in a horrific car accident, and I ended up spending 2 months in a naval hospital rehabbing and multiple surgeries. And I got to spend a ton of time with the medical staff there. And I thought, this might be a direction I want to go. They were so good to me. I got such good care. It was an experience I wish I hadn't had, but it was definitely a life-altering experience for me. So I went to Calcutta Healthcare Center. They told me they could get me a job, which they did. And I kept telling my wife, this is going to be temporary. This is going to be temporary. Well, 30 years later, it wasn't very temporary. Once I started there, I just really fell in love with the fact that you got to kind of know your patients better, your residents better, because you spent more time with them. It wasn't like going into the hospital where, you know, you might have somebody 3 days and they go home. And I just really loved it. And then in 1999, I took over at Caprice Healthcare Center as the administrator. In 2004, I was promoted to VP of Operation. At that time, we had, I think, 3 buildings. And in 2007, my boss alerted me that he wanted to sell. And I put together a group and we bought him out. And so then we've grown to 4 skilled nursing facilities and 2 assisted livings. We've also have our own pharmacy. We have our own transportation company. We have our own wound care company, our own therapy company. We have our own psych company. We also have a bracing company and a private duty home care.
Wow.
So we've been busy since 2007.
You sure have, and definitely speaks to that continuity of care as you were talking about, to have all of those various offerings under one umbrella. Tell me about your involvement in healthcare outside the walls of Inspira. It doesn't stop here, your leadership.
You know, I do currently sit on OHCA's board of directors. I'm the secretary treasurer there. In May, I will become the chair-elect or the president-elect. Politically, I try to keep my ear to the ground there and make sure that, decisions are being made. I at least have some input along with the great team that Ohio Healthcare provides. We're the voice for those vulnerable residents we care for. Not everybody down there sees that. When you go into a meeting down there, they're looking at budget numbers. They're looking at, I'm looking at human beings. So it's just a huge difference for us to voice that this is the impact, the decisions you make trickle down to the people that need the care the most. So I like to be able to be at the table when those decisions are made.
And you've been doing that for decades at this point.
Yeah. I'm probably all in, probably close to 20 years. OHCA, I think it's been a little over 10, maybe 12. And, ultimately, when we go to advocate in Columbus, we go to advocate for our residents because they can't advocate for themselves. So that's part of our job, is to advocate for them. And I'm proud to do that.